Hi, I'm Chelsea Smith and I'm going to be doing my focused assessment. So before I get into my patient's room, I'm going to check my orders. I'm going to gather up my supplies. I'm going to wash my hands. Then as I go into the patient's room, I'll introduce myself, I'll provide privacy, explain what I'm there to do, and raise up the bed to my comfort level. So we will head into the patient's room. So I'm going to knock. Hi there, how are you doing today?
Hi, good, how are you?
I'm doing well. Can you please tell me your name and date of birth?
Ernie Smith, 32389.
And I'm going to check that against the armband. Looks good. Perfect. So I am here today just to do a head-to-toe assessment on you, mainly focusing on your abdomen since you did have your appendectomy. So please just let me know throughout if you have any questions or if you're experiencing any pain or tenderness or anything like that, okay?
Okay.
All right, so first I just have a few basic questions. Could you tell me what day it is?
November 8th, 2020.
Perfect. And where are you?
St. Vincent Hospital.
You are right. And what are you here for?
I had an appendectomy.
That is correct. So there we're just looking at our part of our neuro assessment. That kind of starts right as I enter the room. I'm assessing his speech, the way he's dressed. Is he reacting and behaving appropriately? We're not sure yet, we'll see. But so that sort of thing. So then moving on to head to toe. So I'm just going to start up looking at the pupils. So I would take my pen light, seeing if those pupils are round, equal, and reacting to light. Good there. And then we're going to look at the skin. I would check those mucous membranes, make sure they're nice and pink. Kind of moving down to the arms, he would likely have an IV site, so I'm going to check that, make sure it's not red, make sure there's no inflammation. That could indicate a possible infiltration. Ask him if he's having any pain or tenderness. So mainly just making sure that that is clean, dry, and intact for that IV site. Moving down, same thing with the arms. I'm just looking at his overall skin color, kind of assessing those 5 P's here. So I'm going to check his cap refill and skin turgor as well. So all that looks good. No indication of dehydration there. And then next I would listen to get a good pulse on him. We'll take it here and we're going to say it's 2+. So that looks good. I'm going to listen to his lungs. Likely he may be lying back, so I listen first in the front, making sure that we hear clear breath sounds. Something else I forgot to mention on the arms, I would want to make sure we didn't have any edema or swelling. And then I may have him sit up so I can listen to his lungs from the back side as well. And then while I have him sitting up, if he's able, I'm going to look and assess the skin back here, make sure we don't have any redness, specifically checking for pressure ulcers in those places where we might commonly get them in the coccyx area, back of the heels, that sort of thing. So I'm assessing that as I go. And then kind of moving down to the legs, similar to the arms here, I'm going to check for any edema. I'm noting the color of the skin, looking at turgor, all of that good stuff. And then we are going to move on to the abdomen, which is the focus of this assessment since he did have an appendectomy. So first I'm just going to look. So not likely, I would have him lying back to do this. So first, just like if I were doing a regular abdominal assessment, I'm just looking first. Mainly going to be looking at that incision site. Is it red? Does it look swollen, irritated? Is there any pus coming out? Is the glue still intact and dry? All those sorts of things. Ask him, is he having any excess pain that, would be cause for concern there. And then I'm looking for any swelling or distension of the abdomen. And I'm definitely not going to be percussing or palpating at all. That's something that the physician would do if he or she wanted to. I would want to auscultate as well, hitting all 4 quadrants, making sure that I hear those bowel sounds, making sure they're not hypo or hyperactive, but that they are present. We're going to say that they are present and we're good there. And then I would ask him a few questions as well. So if you could rate your pain for me on a scale of 1 to 10, so or 0 to 10, 0 being no pain at all, 10 being You just got your arm chopped off or something. Where would you say your pain is right now?
Like a 3.
Okay. And are you pretty comfortable? You're able to get, okay, awesome. When was the last time you had a bowel movement?
Would have been right before my surgery.
Okay. And then are you able to pass gas yet?
Yeah.
Okay, perfect. All right. Are you voiding urine okay?
Yeah.
Perfect. Are you experiencing any nausea, vomiting?
No.
Okay. And are you able to drink and take in fluids okay?
Mm-hmm.
All right, perfect. So that is pretty much it for our assessment. Do you have any questions for me before I go?
Nope.
Okay, perfect. So then I would lower his bed back down if I had raised it up for myself. I'm gonna let him know when I'll be back, so I'll be back to check on you in about 30 minutes. Place his call light near him. Please don't hesitate to push that button if you need anything. So then I would wash my hands, clean off any equipment that I may have used if it's gonna come with me. I already said wash my hands, and then document everything before I go as well. And that is it.